A Canada-wide shortage of a common antibiotic has pharmacists looking to alternatives to treat sick children.
Amoxicillin is used to treat chest, ear, and other infections caused by bacteria. Now, it comes in pill or capsule form for adults, but it needs to be mixed by a pharmacist for children. The powder is currently in short supply from pharmaceutical companies.
Kristen Watt is a pharmacist and independent community pharmacy owner in Bruce County. She's also the Ontario Pharmacists Association's Pharmacist of the Year, so congrats on that. And she joins us live now via FaceTime. Kristen, first children's pain meds, now this. How significant is this latest issue with this antibiotic?
This one is significant. This one is quite concerning. When it was Tylenol and ibuprofen, I felt that we could manage. We were getting in little bits here and there, and then we suddenly noticed we weren't getting in any antibiotics whatsoever. Realizing the detriment that's going to be to kids' health, it became very concerning very quickly for us. And then we started to see other antibiotics become unavailable really fast. We just noticed this late last week, and already multiple different antibiotics from different classes are no longer available, or at least not available at this time for us.
So, Kristen, what are the alternatives? I mean, Jen's a parent, I'm a parent, lots of parents watching, right? If you have a sick kid and you can't get amoxicillin, you also can't get Advil or Tylenol just over the counter, what can you do to try to bring your kid's fever down or try to ease their pain?
So for pain and fever, we're looking at using adult strengths of ibuprofen or acetaminophen and dosing them for kids. So having a really good relationship with your community pharmacist is going to be really important at this time, because you want to be able to go in and say, my child weighs this much, how much can I give, how often, how much of an adult tablet, how do I hide it, how do I get it into my kids to convince them who are already feeling unwell that they want to take this. So that's going to be really important. But when it comes to antibiotics, that's a whole other ball of wax. We're going to have to work with the prescribers. We need to understand what we're treating kids for. There are some adult pills and capsules that we might be able to use, or we might have to look at alternative antibiotics, go down the line and select other alternatives.
So, Kristen, I'm not sure if you've heard anything from parents, but apparently the shortage in kids' non-prescription medications like Tylenol, Advil, it's not the same situation in the States. So would you advise parents to drive an hour to Buffalo and stock up there?
So part of the problem of stocking up is that we get into a situation like toilet paper in March of 2020. So we only want to take from any shelf what we need. I mean, if you have access and the ability, the time off to cross the border, of course, go grab a bottle. But a bottle, we don't want anybody to go and grab 6, 10, 12 and then deplete the supply there, because it's going to spill over. We're going to see shortages that spill over into other jurisdictions, other locations, and other products if we're not careful.
Yeah, that creates a sort of cycle unto itself, Kristen, what you just explained there. But what about the sort of shortages, you know, especially when it comes to amoxicillin? What kind of lengths yourself as a pharmacist do you have to go to then to try to fill a prescription for amoxicillin at this point?
That's really challenging for us, because it's trying to get a hold of a prescriber who's really, really busy. We've heard over and over again how busy emergency departments are. So trying to track down a prescriber to select an alternative, because in Ontario, pharmacists can't select an alternative. That is something that would be incredibly helpful, that if we had the patient in front of us, knowing their diagnosis, if we could simply select an alternative, but there's a limitation in our practice abilities at this time. So we can't select an alternative. We need to go back to the prescriber and have that conversation about what we do have available on our shelf and what we could possibly do for these kids.
Okay, well, listen, Kristen, we really appreciate the time this morning. Kristen Watt is a pharmacist and an independent pharmacy owner. Appreciate the time this morning. Thank you.
Thank you.
Thank you.